Just last week, a judge ruled that a 32-year-old California woman did not need to serve prison time for stabbing her boyfriend to death during what prosecutors called a cannabis-induced psychosis.
A study showed disorders triggered by cannabis use are increasing. That's according to data from the healthcare analytics company Truveta. Rates of cannabis-induced disorders grew more than 50% between 2019 and November of last year. So to help us understand the link between cannabis use and mental health, let's bring in Dr. David Schreiber. He's a child, adolescent, and adult psychiatrist and the CEO and co-founder of Compass Health Center. Thanks for joining us. So we were talking, Vlad and I and Tony DeCopa were talking much earlier in the show about like the cannabis that is available now. It ain't your grandmother's cannabis, right? It's not the cannabis from like 1969, much more potent. When people say, give me a break, it's just a little bit of weed. We're talking about a different kind of drug. So can you give us a sense of, though, just how often or how much of a problem this could be that cannabis users experience something like a cannabis-induced psychosis?
So thank you for having me here today. So let me first start off with a bird's eye perspective here. Let me share two validating points that illustrate that this is a problem across the country. First one on a national level. As mentioned, there have been a lot of studies since 2019 of our emergency rooms across this country. What we learned from those studies is a 50% increase of adverse events as a result of cannabis use. So 50% more emergency room visits as a result of cannabis. I'll also say on a local level here at Compass Health Center, we treat complex psychiatric disorders, and we have 54 specialized programs across Illinois and Maryland. What we learned over the years, when we see a spike of utilization of specific programs, it gives us a good pulse of what's going on in the community and across this country. And what we've seen over the last few years is a significant spike in utilization of our co-occurring mental health and substance use disorder programs.
All right, so help us understand the link between cannabis and the development of psychosis or psychotic disorders.
So it's very important to recognize that there is a lot of suffering. And unfortunately, as a doctor, I've treated a lot of people who are suffering from these psychotic symptoms. But before we go there, I want to recognize how we got here. And I want to take us back a little bit and talk about the different factors that have contributed us to getting to this point. So first is to recognize that this didn't happen overnight. There are multiple factors that have contributed to this. First one is accessibility. In 2019, we had 11 states that legalized recreational use of cannabis. Today, there are 24 states, and that number should go up to 29 by the end of this year. So accessibility increase is contributing. The next one is, as we talked about before, and is potency, is to recognize cannabis today is different than cannabis of previous generations. In the 1990s, we had potency, concentration of THC in cannabis hovering around 4%. Today, that number is closer to 20%, so 5 times the greater amount of potency. We know because of technology today that there are products being marketed out there that are able to achieve 90% potency. And there are a lot of studies that are shown out there that increased potency concentration also correlates with increased adverse events. So potency is contributing significantly. And last but not least, it's important to talk about COVID. We all suffer through COVID. And we all want to move on from COVID, but we all have to recognize there is an aftermath. And across this country, we are seeing spikes in psychiatric conditions, depression, anxiety, OCD, trauma, substance use, like I mentioned beforehand. And what we do know is that when people aren't getting the care that they need for their psychiatric disorders, they tend to self-medicate. And one of the drugs that people tend to use to self-medicate is cannabis. So it's all those things that are contributing to how we got here today.
And you know, some of the articles that I read sort of indicate that young people in particular are extra vulnerable. Is it just because, you know, they're young and so maybe they don't make the best choices because, you know, developing brain? Is that the primary reason, or is it also sort of all the other factors that you pointed out?
So it's an important point to recognize, yes, they are vulnerable, but it's important to us to recognize is that there is a lot that we can do. And this is what I talk to my patients about all the time who are very concerned, or their parents, is the importance of the 3 E's. The important to educate, engage, and enroll. First, educate. Make sure you get the information that you need from trustworthy organizations. That might be Compass Health Center. We have a really good resource on our website, compasshealthcenter.net. Or NAM is another trustworthy organization, National Alliance on Mental Illness. Once you get that information, it's important to engage in conversation. Engage in conversation with your children, with your loved ones. Give them the information they need to help them make healthier decisions. And then last but not least, it's important to enroll. Get the care you need when you need it. It's important for us to recognize, as parents, we know our children best. And when we see them deviating from their normal behavior or loved ones acting differently or acting in a bizarre way, it's important for us to get the care that they need. Get the care from organizations like Compass Health Center that know how to treat complex disorders or other trustworthy organizations that you might have in your local community.
That's all. That is news you can use. Good advice, Doctor. Dr. David Schreiber, thank you very much.
Thanks so much for having me here.